This is going to be Critical Care Pharmacology Part 13, and we're going to talk about H2 blockers and proton pump inhibitors. Used to treat ulcers. Stress ulcers common in ICU patients and critical care patients, and essentially we're going to either affect the parietal cell and inhibit the proton pump, and these would be proton pump inhibitors, or we are going to block it with a H2 receptor blocker, and this will disable the pump as well, or inhibit the pump as well. Either way, we get a reduction in the amount of hydrochloric acid that is actually secreted by the parietal cells in the stomach. Ranitidine, or Zantac, class on this is going to be a gastrointestinal agent, H2 receptor antagonist. Action: serves as a potent H2 receptor antagonist, H2 blocker. Inhibits basal gastric acid secretions. Indications on this are going to be ulcer prophylaxis, and GI bleeding. Contraindications: allergy to ranitidine or its derivatives. Side effects: cardiac dysrhythmias can actually occur. Varying versions of cardiac dysrhythmias have been noted with Zantac, including PVCs, Ranitidine, and so on. Nausea and vomiting, rash, reversible mental confusion in the elderly, and constipation. Kind of slows things down. Dose on this for the adult: 50 milligrams and 50 mils IV push over 15 to 30 minutes every 6 to 8 hours. Pediatric: 2 to 4 milligrams per kilogram a day and divided into doses. So probably over 8-hour periods would be appropriate. So three dosings. Special considerations: uses cautiously in the elderly and the critically ill, and the elderly might actually get some mental status changes from the Zantac. Use cautiously in patients with hepatic and renal impairment. Class on this is Cimetidine, or Tagamet. Class on this is going to be a gastrointestinal agent, H2 receptor antagonist. Action: serves as a potent H2 receptor antagonist, exhibits some H1 effects, inhibits basal gastric acid secretions, indirectly reduces Pepcid secretion. So this is both going to be coming from the parietal cells. Indications: ulcer prophylaxis, and GI bleeding. Contraindications: allergy to cimetidine or its derivatives. Side effects: cardiac dysrhythmia on this one as well, nausea and vomiting, rash, drowsiness and reversible mental confusion in the elderly, and impotence. Dose on this is going to be for the adult: 300 milligrams and 50 mils over 15 to 30 minutes, and that's going to be given every 6 to 8 hours. Pediatric: 20 to 40 milligrams per kilogram per day, PO, and this is going to be divided into doses. Probably every 8 hours would suffice, or every 12 hours. Special considerations: use cautiously in the elderly and the critically ill. Monitor for mental status changes. Use cautiously in patients with renal impairment. Famotidine, or Pepcid. Class on this is going to be a gastrointestinal agent, H2 receptor antagonist. Action: serves as a potent H2 receptor antagonist, inhibits basal gastric acid secretions, again through the parietal cells. Indications: ulcer prophylaxis, or GI bleeding. Contraindications: allergy to famotidine or its derivatives. Side effects: cardiac dysrhythmias, nausea, vomiting, rash, reversible mental confusion in the elderly, increased BUN and serum creatinine, and these are going to be kidney markers. So we can actually increase the BUN and creatinine. This should always be at a 10 to 1 ratio. Dose on this: 10 to 20 milligrams and 10 mils IV over at least 2 minutes every 12 hours. Pediatric: 0.5 milligrams per kilogram every 8 to 12 hours. Maximum dose is going to be 40 milligrams daily. Special considerations: use cautiously in the elderly and critically ill. Monitor for mental status changes. Use cautiously in patients with renal impairment. Antiemetics: vomiting, not only a discomfort for the patient, it can increase their chances of aspiration, electrolyte imbalance, and increased interthoracic and intracranial pressure, depending on what your patient is actually presenting with. Promethazine hydrochloride, Phenergan, Class on this is going to be a gastrointestinal agent, antiemetic, anti-vertigo agent. It's a phenothiazine as well. Actions on this: acts as a phenothiazine derivative, serves as an antipsychotic, shows H1 receptor and vomiting center blocking properties. At low doses, it's relatively free of extrapyramidal effects. At higher doses, we can actually have some dystonias from this, to where the patient almost seems rigid, or extrapyramidal symptoms. Indication: nausea and vomiting, medication administration, flight, disease pathology of any sort. Contraindications: allergy to promethazine, stenosing peptic ulcer, comatose state, bladder neck obstruction, narrow angle glaucoma. Side effects: can get extrapyramidal symptoms with high doses or rapid IV administration, torticollis, stiff neck, ocular gyric crisis, which is spasmodic movement of the eyeballs, tongue protrusion, convulsive seizures, altered mental status, CNS depression, respiratory depression, cardiovascular depression, urticaria, leukopenia, and dry mouth. Dose: 12.5 to 25 milligrams slow IV push every 4 to 6 hours. 25 to 50 milligrams IM. Pediatric: 0.25 to 0.5 milligrams per kilogram slow IV push every 4 to 6 hours. 12.5 to 25 milligrams intramuscular or IM. Special considerations: treat extrapyramidal side effects with diphenhydramine, and the dosing on that is going to be 12.5 to 25 milligrams IV as needed. Prochlorperazine or Compazine. Class: psychotherapeutic agent, phenothiazine, gastrointestinal agent, and antiemetic. Actions: exerts antiemetic effect via depressant action on the chemoreceptor trigger zone. Controls vomiting in the CNS. Indications: nausea and vomiting, medication administration, flight, disease pathology, psychotic disorders, anxiety. Contraindications: comatose state, CNS depression. Side effects: extrapyramidal symptoms, also with this one, with high doses or rapid IV administration, torticollis, stiff neck, tongue protrusion, convulsive disorders, altered mental status, CNS depression, respiratory depression, cardiovascular depression, urticaria, leukopenia, and dry mouth. Dose: 2.5 to 10 milligrams IV push over 1 to 2 minutes. Repeat every 6 to 8 hours. Maximum dose: 40 milligrams a day. Special considerations: treat extrapyramidal side effects with diphenhydramine or Benadryl. 12.5 to 25 milligram IV as needed. Ondansetron Hydrochloride or Zofran. Class on this is going to be gastrointestinal agent, antiemetic. It works off a serotonin 5-HT3 receptor antagonist. Actions on this are not really fully understood, but selectively it works off a 5-HT3 receptor and antagonizes it, which will decrease nausea and vomiting. Acts peripherally on the vagus nerve terminals, works centrally as a chemoreceptor trigger zone. Indications on this are going to be nausea and vomiting, medication administration, flight, disease pathology. Contraindications: allergy to ondansetron or its additives. Side effects: hypotension, tachycardia, constipation, elevated liver enzymes, CNS depression. Dose on the adult: 4 milligrams IV over 2 to 5 minutes every 4 to 6 hours. Pediatric greater than 2 years old: 0.1 milligram per kilogram slow IV push every 4 to 6 hours. Special considerations: use cautiously in elderly and patients with renal impairment. And Zofran, for the most part, is a very good drug. The other drugs in this list tend to give you extrapyramidal symptoms sometimes on the specific patients. Ondansetron or Zofran will not give you extrapyramidal symptoms. This ends part 13. If you have any questions, feel free to contact me, roy.smith@redlandscc.edu or smith@edmsa.net. Thank you.